Good evening. New York Edge and Fidelis Care present Supporting the Mental Health and Wellness of Our Children. To kick us off, New York Edge CEO Rachel Gazdick.
Good evening, everyone, and welcome. I'm Rachel Gazdick, CEO of New York Edge, and I'm so pleased to welcome you all to tonight's very important discussion. New York Edge is proud to partner with well over 116 schools across all 5 boroughs in New York City and now Wyandanch on Long Island. We provide enriching after-school and summer camp programs that build on the school day, learning, and give students the opportunity to explore their talents and interests. We infuse social emotional learning throughout all of our programs in academics, the arts, sports, college and career readiness, because we understand the critical importance of supporting the entire student. Tonight, with our partners at Fidelis Care, we're going to talk about how to support the mental health and well-being of our children with experts, Dr. Foyer from Northwell and Dr. Reeves-Bright from Fidelis Care. Our panel tonight will be moderated by ABC News anchor, Mike Marza. I'd like to thank Fidelis Care, Mike, and our panelists for being here tonight. I'd also like to thank the parents, staff, and supporters in the audience tonight. It takes all of us to guide and support our children to realize their dreams, and we are proud to partner with you. Take it away, Mike.
Rachel, thank you so much, and thank you, everyone. It's truly an honor to be part of this tonight. As Rachel alluded to, I am a father of 3. Our oldest and our only son turns 9 on Sunday, which happens to be Championship Sunday, so he's super ecstatic about watching some NFL football with his friends and also celebrating another milestone birthday. Our middle child just turned 7 a couple of weeks ago, and then our baby, she'll forever be our baby. We remind her she is 4 years old. And I know at 7:30 in the evening, it is a busy, busy time. So we totally appreciate you participating in such an important discussion. And I know that it is daunting for so many people, being a parent in general, but especially dealing with some of these really tough issues that so many people are dealing with right now. And that's why it's exciting to get an outlet like this and have an open dialogue and a conversation to dig into some of the solutions. So I do want to begin, because I know our time is limited, and I want to begin with Dr. Reeves-Bright. Now, I'll just toss this out. I mean, what are you seeing as far as your conversations and the patients you're seeing? What are some of the biggest mental challenges right now for some of the young patients out there?
Hi, good evening, everyone. I'm so happy to be here to join this conversation. Mike, that's a great question. We know that even prior to the pandemic, addressing children's mental health was quite a challenge, where there were already lack of resources and limited number of providers. And the COVID-19 pandemic really exacerbated what was already a real concern. Mental health issues are on the rise since the dawn of the pandemic, and has really highlighted a lot of communities and populations that have been impacted more significantly. And really so much so that the Surgeon General issued an advisory, a state of emergency really on the state of children's mental health in 2021. I say all that to say roughly that we're seeing a number of mental health issues that continue to impact students and children across the board. There's a piece of data that stands out to me. In the U.S., 1 in 5 children ages 3 to 17 have a mental, emotional, or behavioral disorder currently. Most of those being anxiety, depressive disorders, but also looking at the impact of trauma, also substance use, eating disorders, and it runs the gamut. And I think Dr. Fourier will speak a little bit more about what she's been seeing in the schools.
Yeah, and to that point, and it's just alarming when you talk about 20% of that age group dealing with these issues. And I do want to go to you, Dr. Foyer, because first of all, if you can explain what you're seeing in the settings that you're in, but then also what are some of the solutions that are being given to parents that they can try to help their kids out?
Yeah, so I'm also very excited to be here and join the conversation. Important topics, very pressing now more so than ever. Really I work in emergency crisis and school settings. So I work with kids in the hospital setting and with schools. And working with school professionals, we hear the same that we see in our clinical services, a definite increase in anxiety disorders, lots of difficulty for many kids still transitioning back to school, transitioning back with catching up with whatever they lost during the years of the pandemic. So I think there's issues there. But I just want to highlight also that these issues were there before the pandemic as well. I mean, we haven't mentioned the other very important statistic, very sad and important statistic, suicide being the second leading cause of death in kids as young as 10 and through young adulthood. And that is something that I think is really important to remember, that this is something that is so significantly important to address as a public health issue. As far as what parents can do, so I mean, I think it begins early, and it begins with things that parents can do, and that is really helping their kids grow and develop in a way that they are learning to communicate, that there's open channels of communication about various things, including our feelings and emotions, and how we're reacting to things, and modeling behaviors for them that they can then learn to apply to themselves. And starting that early on and really being engaged, really being able to have open conversation, engagement, a place where it's okay to say, I'm angry. Mm-hmm. And the answer is not, well, you have no reason to be angry, but the answer is, I understand that you're angry, and let's see, how we can help you deal with that.
No, that's interesting. And I do want to go to Dr. Reeves-Bright and pick up on that point, especially when it deals with the pandemic. But staying with you, Dr. Foyer, I mean, in those moments, how do you know, especially for, like I mentioned, our oldest is turning 9 this week. So for him, we've never had a 9-year-old before, right? So all of this is new for us. How do you know as a parent, this is something that's normal, or this is something that needs more attention and perhaps needs a professional to step in?
Yeah, so I mean, I think again, if you do have that baseline, when everything is going well, but at baseline we have an environment at home where we validate and talk about feelings, where we have open channels of communications, where we're tuned in our kids, it is easier to notice the red flags. But the red flags really are when your child is not themselves. So yes, there is some developmental change, but there are ways that parents recognize that your child's not their usual self, or not doing the way that they have been doing, or not functioning the way that they've been functioning. So let's say in school, they're not doing as well, or with their friends, they're not engaging the same way, or their sleep gets disrupted, or something is off, something you're feeling. And then really when we're talking about when to seek help and when to seek professional guidance, is when it has an impact on their quality of life and functioning, is when that's necessary, and then a better idea of can be had of what the issue is and how we address it.
No, it's a great point, and you can kind of chart a way forward from there. I want to go back to you in just a moment, but I want to bring back in Dr. Reeves-Bright, because when we talk about the pandemic, it was such a monumental moment in all of our lives. And I'm not confident that we've all fully digested exactly what happened and what we went through and what we saw, what we didn't see, just the disruption in the everyday life. And for parents especially, not only trying to keep their kids on track, but then also dealing with that same stress as well. And as we know, kids pick up on that. So how much of the pandemic has played a role in some of the numbers that you were talking about? And then how do we try to, if you want to say normal, but get back to recognizing that was such a disruption, but now we hope the height of the pandemic obviously is past us and we're sort of getting better, it seems like, as the weeks go by. How do you deal with it all as you're trying to make sense of it as a parent, but then also trying to restore some normalcy for the kids at home so they're calm and they can continue to develop normally as they would, before the pandemic?
Sure. So I think that, we have to be concerned about the impact of the pandemic, even for several years to come, right? So we don't know exactly how this will play out. Particularly, this is a period of disrupted growth for children, growth and learning. So from the toddlers who didn't have those key years of socialization to teens that had those years that were taken away in forming peer relationships. And again, not to mention the loss and the trauma that was endured by families and children during the time of the pandemic. So, it's really, we have to think about some of the long-term effects of that on families and children. If we really start to restructure and change our language, I think about the pandemic. So instead of talking about sort of the years that we lost, yes, acknowledging those, but how do we move forward? There's something called post-traumatic growth. So after that trauma and you've survived a trial, it really helps you build some resiliency, right? To know that you've come through this. You can sometimes, things are still unknown, but we're able to manage, those worry thoughts and those anxieties together. Really having that open line of communication. And as Dr. Foyer mentioned, parents really keeping a pulse on their own anxiety and setting an example for how to manage that.
That's a great point. And Dr. Foyer, I have another question about the online component to this, because we've so much, even now, I mean, this is a webinar, and perhaps, years ago we would have big conferences and people are now familiar with this type of communication, kids as well. I mean, for so long they were online schooling. I want to get to that in a moment, but I want to pick up on what Dr. Rieswright was saying and how the teachers can play a role in this, because you're familiar with the school setting, and how schools are adapting and recognizing things, and how it's important to have that open line of communication with the child's instructor too, right?
Yeah, absolutely. So really, those adult figures in kids' lives, they're at home, at school, in the community, they're so important in terms of supporting kids and having kids feeling connected. And I think, we talk about the impact of the pandemic. I think in addition to that, we got to talk about something, again, the pandemic was oil on it, but a pre-existing impact, which is technology. Yep. And how technology is changing our kids' brains and how early it starts impacting on them, and what the impact on their communication style, engagement style, learning style, overall development, and how that is part of what we're seeing, not just, and then the pandemic made that, even bigger, because now more time, now we're doing more things. Now there's really cool, innovative things, right? That people are doing, but still it's more time, more engagement in a very different way. And I think we are hearing that coming from the pandemic, from the schools, is that kids have difficulty engaging with each other in person, in real life, especially in the beginning when we first emerged. A lot of kids had difficulty with that. Knowing the boundaries of each other and engaging with each other. But engagement, certainly a big theme, and connectedness that has been coming up.
And because they've been so immersed in this online world for a couple of years, and even as you mentioned, even before the pandemic, it was becoming more popular, even for the parents. I mean, how often do you see the parents are the ones that are just scrolling and they're doing things, and kids pick up on that, of course. I mean, I can't tell you how many, we have 2 phones, and then between my wife and I, we have 4 cell phones at home. And so, we really have to be mindful of putting those down. The kids remind us of that because they pick up on those habits, and they're young, not to mention the tweens and teens who perhaps may have their own devices. I do want to get your thoughts on this, though, because as kids have been online and now they're being exposed to these social media apps and everything else, and the feedback, often anonymous, has been really detrimental. We've covered stories about these bullying incidents, and they're coming from, it used to be maybe, back in the day, it was a kid that said, hey, I want your lunch money or something like that, face to face, and you knew the adversary, you knew where the problem was coming from. Now it's these comments that really rewire the kids' brains, and it's a real big problem. What are you seeing as far as the online bullying component to this stuff?
Yeah, so we definitely have seen a lot of that, and at the Children's Hospital, we actually, even before the pandemic, we had a bullying and anti-bullying program where we're working with student advocates to do projects in their schools to combat the bullying problem. During the pandemic, they were very clear about that, even before, but during the pandemic, especially, how all of that shifted to online and to a lot of cyberbullying, and it really changes the scene. It's much more pervasive. It's much more, like you said, much more sort of drastic, right? Because there's this, perceived distance and anonymity, and people will say and do more extreme things. So certainly an impact on that, that we're seeing, certainly one of the dangers. And again, for the parenting, just to comment on how parents get engaged, again, really conversations really early on, structure, rules, knowledge, being involved in their online lives like you are in their day-to-day life, knowing what websites, what apps, what content they're watching, and having that be a conversation. Hey, teach me, show me, how do you use this? What
Yeah.
are you doing? Why
If-
is this so fun? Why is this so popular?
No, that's a great point, because it's often the kids that are leading the evolution of these devices and the apps and all of that. So there are programs and apps out there that you may not even know exist, but the kids do, and they're on it. So no, that's a great point. And to that point, I want to pick up on Dr. Reeves Bright's perception of this, or analysis of this, because it seems like, kids, they're great devices for a lot of things, for homework and certain things, communication. We've talked about that. But maybe a way to combat some of these challenges is to get the kids more physically active. Is there a way that you've seen that be successful for some of the patients that you have seen, is just, making sure that the kids are in better moods because they're just physically more active, which is something that seems like it's harder and harder to do for some families?
Right. I mean, it definitely becomes a challenge. We know that our minds and bodies are very much interconnected, and we have to nurture both of them, correct? Right. So, eating healthier foods can boost our mood, the endorphins and the energy that comes from exercise. And whether it's, if you have the ability to do, a half-hour online class, or if it's just turning on music in your living room and dancing around with your kid, as long as you get moving, that's the idea. It really does help to improve our ability to make decisions, to concentrate, to really handle stress and hope and prevent down the road episodes of, depression, anxiety. I have to throw in sleep is a huge component. It goes in that trifecta because, there's emerging studies that show that limited sleep or disrupted sleep on a child's brain can significantly impact a child's brain development. So those are things that we really want to make sure that we're combining for parents as well as for children to, make sure that they've got a well-rounded approach. And I always have to make a plug. I say you're never too young to practice or too old to practice self-care. So really building in those strategies that, you have time for yourself, or you have means to really ways to reduce stress, whether it's physical, whether it's spiritual, emotional, those are ways that really help to build that resilience that we talked about earlier.
And Dr. Reeves, right, what about what we eat? I mean, there has to be a tie to that too, right? Just what we put in our bodies will make us feel a certain way.
Oh, absolutely. Absolutely. So, I mean, we know that, there's things that we eat that are healthier than others can really boost our energy. It can improve our mood. When we sometimes, get into a place where children may feel, and even adults may feel more down, and you start to treat your body very differently by what you eat. So it's something that we always have to be very conscious about. I mean, everyone has a splurge, every now and then, or times where you're making a choice that that you would only do once in a while. But I think it's important that as a whole, parents are trying to incorporate healthier foods into, our diets at home. And, definitely give yourself grace. It's not perfect every night, but the more we can, tackle it every day, I think that we will be able to get more days than not where we're getting those good foods in.
And Dr. Foyer, we see this play out in the classroom too. If kids are hungry, if they're not eating the right things and they don't have the right sort of levels of nutrition, then that's going to affect their school day as well.
Absolutely. And the sleep is a huge one. I mean, I think, that is something that I see with high school students, especially. First of all, I think everybody underestimates how much sleep high school students need, because in fact, they need pretty much as much sleep as a 7, 8 year old child, because their brains are developing rapidly still. And so they do, I mean, it's a range of what they need, but they need more than they get. And disrupted sleep with devices as well, big culprit in disrupting kids' sleep, and the impact on sleep, on learning, on mood, on everything like that is huge, because our brains need to recharge, just like our devices, right? Like they need to recharge, they need to shut off. And that's another comment about exercise, and a lot of these activities are also important, not just for the pure physical impact that it has on our mood and our cognition, but also because kids are, their minds are so full, right? They are constantly have input after input after input, and information processing through their brains at a much younger age, at a much higher rate than probably ever before. And so they need breaks. Their brains need breaks. And exercise is one example of how you can really disconnect from worries, from past thoughts, and you can really stay in the moment. What, the buzzword of being mindful, right? So that's what that really means. Is just not thinking about the tomorrow, the yesterday, just but being there with the experience that you're experiencing. And that's another reason why any kind of exercise and music and yoga and hiking and being outdoors, there's evidence that being outdoors also has an impact on mood, just being outside, which is also something that's a challenge for many families.
Now, I want to ask you both, because this sounds great and we understand the reasons behind it. But let's talk about the execution, because when you're, when you're in it, and it's 8 o'clock and the 4-year-old keeps pushing away every possible thing you've tried, how do you go from there? And it kind of, to me, it seems like, at least at our house, not it's just, we try to introduce things. Sometimes she'll try it begrudgingly, but she has this, which is great, and it will help her later in life, I believe, is that she's very stubborn, and she just will not try certain things. Now she's in this period, so we get the benefits of it, but how do we get the kids to actually do what you're saying? We'll start with Dr. Foyer.
Sure. So, I mean, I think, we talked about setting the stage at home in terms of being in an environment where when the kids do something, they don't feel judged or in trouble. And instead they're taught about how to do things in a positive way. So, positive parenting is all about trying to encourage positive behaviors and sort of reinforcing them, from the get-go. And then modeling is, I think really important, because we all have feelings and our feelings rise. Being, I'm a parent too, just, wait until it's the 14-year-old.
See, that's a whole different chapter, right?
Right. Each chapter is beautiful, and each chapter has its really, really great stories and its own challenges. And it's really important for parents to have an understanding of each developmental period and what they can expect of their child. You asked earlier about, how do you know what's normal and and we talked a little bit about the red flags when things are really not going well, but really learning and knowing about what's expected for that age, so that you're not expecting your child to do things that they really, not that they don't want to do, but that they cannot do, at certain ages, and being, sort of thoughtful about being developmentally, attuned to them. So I mean, there's many other, I think, each age group has its own sort of strategies, and they're a little bit different, right? The needs change for the kids from what they need from us as parents through development. But Dr. Reeves-Bright mentioned resilient parenting, and just the same as from the COVID pandemic, what are the things that we can learn, and what is the growth that we can bring with us from each difficult experience that your child has, teaching them what to come, what can you learn from that and how can you grow from that, having that mindset is really important. And resilient parenting really requires both, again, structure, validation, and open communication, and being attuned.
No, great points, great points. And before I toss it over to Dr. Reeves-Bright to get her thoughts on this, and as far as the execution on how we can make these things happen, I do want to mention to anyone who's watching, if you do have a question and you want to participate with a specific note or something that you want answered from the doctors, please click the Q&A and submit your questions. We'll definitely try to get to it. Dr. Reeves-Bright, so how do you get the kids, in that mindset? Modeling is huge. I fully appreciate that, and I think that that's something that we can all be better at. But how do you introduce these things, these healthy habits, whether it's sleeping more, whether it's eating better, things like that can really help the child succeed?
I think an important component of any of those things also stems around a good routine, right? So if dinner time, if we're keeping to a set time as consistently as possible, so that the child knows what to expect, knows what might be coming, even if we're planning ahead, and whoever's preparing the meal talks about what might be served for dinner, and then giving them a little bit of autonomy that, okay, you can either have peas or you can have carrots. So they feel like they may have some sort of choice in the matter, which may engage them more to readily try new things. So I think that whether that's from, new foods or to a social media plan, so, helping to them create, letting them have a say in some of the strategies and happenings that are happening at home. But I did want to mention that, for any parent at any time where there are questions about, what should my child be doing or not be doing, I would encourage to reach out to their pediatrician or healthcare provider to say, I have this question, I have this concern. Is this something really we should be connecting with someone long-term for treatment or intervention? Because we don't know everything, and that's why we have trusted adults and pediatricians in our lives. So use them as a resource.
I think so often as parents, we forget, especially with the young ones, that they are little humans and they're individuals, and one size does not fit all. We certainly appreciate that. You mentioned social media, and I want to go back to that point because it has been so omnipresent in our lives. How do we create healthy habits for kids? And I know this is going to be different age groups, so feel free to put some sort of categories on this answer. But Dr. Foyer, I'll start with you. As far as a children's mental health and when it relates to the digital stuff that they're exposed to, especially social media, how do you establish those healthy habits for that?
Yeah, I think it's a really important topic and a great question, and we could have a whole other hour dedicated to just this,
Right.
Because there's no quick and easy answer. As first rule of thumb, I will say that there's no monitoring app or anything that substitutes for engaged parenting. There are tools that you can use to help guide you as a parent on this journey, but really important that the conversations with your kids start as early as possible about what, even before social media, what other technology, are they using in their life and how much, and what are the household rules about it. Dr. Reeves-Bright mentioned the social media plan or digital family plan. What really that means is agreeing to the household rules, and that includes, Mike, to your point earlier, putting your own phones away during dinner time, or whatever your rules are in the family, but really then, setting that as an important guideline, and those guidelines will change as the kids grow, because the guidelines about how much time they should be spending and what kind of content they should be spending, changes. It really is not just quantity, it's really content as well. With young kids especially, I think a really important point I like to make parents is that there's a huge difference between your child alone clicking on YouTube and watching videos, or you sitting down with them, watching something together, knowing what they're watching, discussing it, again, engaging in the conversation about why, what do you like here? What do you tend to watch? so that later on it becomes, a norm conversation that we're talking about what foods we like and what we watch on YouTube. So I think that's a really important point. And again, I think, with the devices, it's so easy to sort of it's very engaging for the kids, right? It's a very easy way to engage them, and it's a very difficult thing for them to disengage from,
Yes.
especially if they're using excessively. So being ready to provide alternatives, and then as they get older, teaching them what are your alternatives, what other things can you do with your free time, and having activities like all these things we discussed earlier, right? Like physical activities and being engaged, all of these other things in their life. So technology and technology time is not the only thing that they're doing.
That's a great point. Dr. Reeves-Bright, it's a complicated issue. Every kid is different, like we talked about. I mean, for instance, our now 8-year-old, my wife and I have been resistant about the video game systems. Some of his friends have some, but we just were holding off. Well, my wife's uncles got him a Nintendo Switch for Christmas. Very generous. We appreciate the gift, but it created a conversation between my wife and I. And so we started researching it even more. And we said, okay, 2 games, the Mario Kart, which is obviously very well known, and then this game Just Dance, where they put on these controllers and they dance around. So I was thinking, okay, we're on to something here, right? Physical activity. And we said, well, limit the time. And we let our son play with the daughters too. They were playing, but it is shocking how in a short amount of time, this was Christmas, less than a month ago, how it rewires their brain. And to your point, Dr. Foyer, how, I don't want to say addicted, but it is this attraction that, to it that was just so interesting. And I felt like I was the, get off my lawn guy, because I would tell him, go read a book. I mean, draw or something like that. Benefit, yes, in certain instances, but what is a good method to have those conversations in your home, especially when the kids are a little bit older, when they're 12, 13, 14, even adults now? I mean, adults are addicted to some of these devices and things like that. What's a good method that you've seen work for your patients?
So I think that, definitely we know there are pros and cons to social media, right? We talked about some of the cons and some of the pros being, that especially for teens, it does help it gives them a venue to form social connections, particularly when we were in the pandemic and feeling more isolated. But more and more, it also becomes a platform to share ideas. I think there are healthcare providers that are taking to these platforms to provide legitimate education to children about mental health issues and such. So keeping that in mind, I would say that we're not focusing so much on the quantity, but we're also looking at the content, right? Where are they going? What are they looking for? How are they interpreting the information that's coming in to them, and really helping them to be a good sort of citizen on social media versus you being, policing every every site or every minute that they're on any social media, because at some point you're not there, right? So they have to really be able to internalize the ability to know what's appropriate, what's not appropriate, know that things live on the internet, even though when you think they've been deleted, they're still there. Making sure that they know how to protect their privacy, not sharing their personal information, their school, their last names, that sort of thing. So it's really important that we're helping them to create more mindful social media engagement. If they have that plan about, okay, I'm going to go on for 15 minutes because I want to see what's trending. I want to see if anyone sent me notifications. And it helps us, even adults, really, to avoid falling into that rabbit hole where we're on and surfing for hours and hours, if we can be a little bit more intentional before we go on.
And do you think when the parent can, carve out that time then and actually use that time where it's, no screen time to actually do some old fashioned things like some arts and crafts and take walks and maybe go toss the ball around or shoot some hoops? I mean, that seems like that's a time ripe for that sort of connection to make them want that in a way.
Right. They may not even thought about it. So as you had to give your children suggestions as to what other things to do, It's the same for a child of any age, especially teenagers. Or is there a way that you can go connect with one of your friends versus, texting or whatever, the other forms of connecting online, really have a face-to-face in real life engagement. Of course, organized sports or drama, any extracurricular activities. But I think when teens or even children are really engaged and caught up in the online social media and presence, those things become less to the forefront of their mind. So it really, I think it's important for parents to help them create some other ideas how to engage.
Great points. I do. Oh, Dr. Foyer, did you want to add
Yeah, I
something?
just wanted to add two things. One is that I do think that I see for many kids, it really is, especially some of the mindless scrolling through videos and just watching thing after thing after thing. It really is sort of an avoidant escape behavior. A lot of the times it's a lot easier to do that than to do the overwhelming amount of tasks or responsibilities that they feel they have, especially high schoolers, if they're feeling academically stressed, which I think, again, emerging from the pandemic, we're seeing more because there was learning loss and there was an impact there that they're still all trying to catch up on. So it's especially stressful. And then the other point that I often make or try to, or the metaphor that I use for this for parents is that it's kind of like you can explain it to your kid, kind of like a food pyramid, right? Like you can have everything, it's just not the same amount of everything, and you have to have variety. You can't just do one thing all the time. It's not good for your brain. Your brain needs like other kinds of activities other than just being on technology. And explaining it to kids that way, and then giving them opportunities to try out the different things, like Dr. Reeves-Bright was mentioning, different opportunities of getting engaged in different other ways. And depending again on the age of the child, with the younger kids, you as a parent a lot of the times need to be available for that.
No, great point. That's a great point. And we were talking about the whole collection of this ecosystem of, it takes a village. We've got a question now from a kindergarten teacher, and I want to get to this because this is such an important point. This kindergarten teacher writes, I'm experiencing a greater amount of children with separation anxiety many months into the school year. So what strategies can you recommend for that separation anxiety, especially as we talk about, post-pandemic time? Well, Dr. Foyer, you want to start that?
Sure. So separation anxiety and a resulting difficulty getting to school is definitely something that we're seeing in all of our school settings and in all of our clinical services. Certainly a lot of kids still are, being impacted by that. A lot of the times what's really important is to have a good understanding of what the issue is about. And if it is anxiety, a lot of the times helping coaching the parents on how to set boundaries to the anxiety at home, because it is very difficult. And as a parent, it's very painful to see your child be in discomfort and still push them to do something they don't want to do. That's a very emotionally hard thing to do as a parent. But it is really important, and really important to understand that if we don't do that, we're gonna let a child avoid, and anxiety just grows and grows and grows. So really having parents understand that, and being able to have the skills to support and having, again, routines and structure, like was mentioned earlier, is really important when we're managing this. And then working with the kids themselves on learning how to manage their own anxiety is sort of our minds tricking us into making us believe that there's something dangerous happening instantly when it might not. And really having them understand that and having them learn to think about these situations differently is sort of the therapeutic part of this with the kids themselves.
Dr. Reeves, right?
And I think even practically, I think it's important to talk with the parents about the circumstances that are happening leading up to the drop off, right? Is the morning pretty hectic? Are there ways that you can even build in a little more time so that, the child may have more time to adjust to coming into the new situation, which is school, but it seems like a new situation for them every day if they don't know what to expect when they get to the classroom. So I think that the more that the parents can have the routine, so things are less hectic, drop off, and they can give the child a sort of a solid goodbye, have a great day, I will be back to pick you up, or I'll see you when you get home. Sometimes it's helpful for the child to have a object of security for them. So if it's the attachment to the mother or the father or grandmother, is there a personal item or something that reminds the child of that person that they can have with them when they enter into the school building that might be comforting for them?
No, that's a great point. Another question here, another important question. This one from someone who says a sixth grader was crying today and shared that his girlfriend broke up with him. How do you deal with this situation? I mean, this is a rite of passage type thing, nonetheless horrible for the student that's involved. How do you help them work through something like that? Dr. Fourier, we'll begin with you.
Yeah, so, like with any of these situations that kids bring up to us, first of all, it's the fact that he shared is really wonderful, because that's really an important thing to have kids have trusted adults that they can talk to when they're having difficulty, and then managing it in a way where that student feels, heard and validated, and let a lot of the times in these situations, it's very similar to what adults need at that moment, right? You don't necessarily need somebody to fix it. You need somebody to listen, and you need somebody to not say, oh, you'll have more girlfriends, because that really just diminishes how they feel at the moment. And I think as parents, we're very oftentimes we want to make it feel better, right? Like instantly want to make it feel better. That's the instinct. But sometimes it's okay. Hard feelings happen in life, and difficult situation happens. So supportive, validating statements are really important.
Now, you make such a great point to listen. My wife tells me that all the time. I don't need you to fix it. I just need you to listen. Listen to the problem. Listen to what I'm just, let me go through these emotions. That's important, right, Dr. Rees-Bright? That's part of the process of just working through those emotions, vocalizing what you're feeling.
Right. And children often have a lot of difficulty naming their feelings. So the more that we can help them do that and what that feels like, give a name to that, they're better off in the long run. And also recognizing, how that might play out in their day to day. So, there may be times where you see that child's feeling a little more irritable, or maybe more easily upset, and making that connection for them. But I think, also other tools can be to help, direct them to, engaging with other peers and creating, it's a great time to be able to foster new relationships as well. And in ways that they also might, physically kind of soothe themselves, help themselves feel better in the moment, and teaching them some real concrete technique to ease their distress.
Great points. Let's get another question here. What should a parent do when the academic workload becomes overwhelming, especially in high-pressured academic settings? I mean, we hear this all the time, where the kids are getting homework, the test, and all of that. How do you deal with that, Dr. Foyer?
Yeah, dealing with that as a parent myself. But yes, it's I think, like ourselves, like adults, kids can get overwhelmed when the pressure is on, and when there's a lot of competing tasks and things to do, and no time for real recovery and rest, because there's just so much work. So I think as parents, it's important for us to do a couple of things. One is to help them break it down to smaller pieces, so that they're not thinking about all the things that they got to do, because that often just paralyzes them. And really just saying, okay, let's go task by task. What's due first? Really helping problem solve and guide them through how to break it down. And then also to make sure that they do take some breaks, that they sleep enough, that they eat enough, because really having them in this overwhelmed, a lot of the times ineffective state, because the problem is the more anxious you are, the less well your brain works, right? Because all the alarms are going off and you can't think straight. So really at some point that anxiety and stress becomes overwhelming or paralyzing. So really helping break it down, help making sure that they are taking breaks, they're sleeping enough, they're letting their brains rest and recover. Some of the suggestions.
And Dr. Reesbride, I mean, these are important tools to learn, not just for when you're in school, but in work settings too. And this is something that can really go a couple different ways, or maybe even more, when you become so overwhelmed, as Dr. Foyer was mentioning, you're crippled by that. And that could play out even later years in life, I would imagine.
Sure. I mean, the habits that, kids develop at a young age often carry into adulthood. So as Dr. Ford mentioned, helping them break down the tasks, but also helping them with time management. So you've got the tasks broken down. When are you tackling them throughout the course of the week? And again, making sure that they have ways to recharge, to take care of themselves, to really look at this. And I tell my children all the time, this is a snapshot in your lifetime, right? So we have to also put that into perspective. Try not to compare yourself to every other child that, grade wise or achievement wise, the only sort of competition is what you did yesterday. So we're, how are you building upon, what's happened in the past to help you move forward and not use other people as a source of comparison. So I think it's really important to help them be able to prioritize, to be able to also say there might be times where, 2 out of the 12 things that are on your list do not get done because you needed to go to bed early for that night. So it really putting yourself first during times where we know that it can be emotionally taxing. We've seen, situations in the media and the news all over the place that kids are becoming so overwhelmed at an early age. The rate of suicide that we talked about earlier is on the rise over the past decade. So we really want to make sure that kids have an outlet. Hopefully they have a trusted adult they can come to if they're feeling in distress or, feeling that they're unsafe. And as parents, if there's any time where you're questioning your child's safety, that, you're reaching out to, to a pediatrician, to a provider to really gauge if that's something that needs to be addressed, or how urgently that needs to be addressed, I should say.
We have about 4 minutes left or so, and I want to get to this other question that we have. And Dr. Reesbride, we'll start with you this time. This person writes, a lot of schools are prohibiting the use of phones and other gadgets during school time. Do you think this practice is excessive?
Wow. So excessive, I think that's a tough question. I think, excessive is relative. I mean, I think we talked about, again, being able to give students the ability to really take charge of their own time on devices, let's say. So it really depends. Is it done for every child across every grade, or is it for younger kids who may have more difficulty, breaking from that, the ability to get disengaged and create structure for them. I mean, I'm of the mindset as kids are older teens into going into adulthood, they have to be able to make these decisions on their own, to know what's appropriate content, to know what help them shape and make those decisions versus removing the temptation or what's causing the distraction altogether.
Dr. Foyer?
Yeah, also, I'm not sure that I would use the word excessive. I mean, I do think kids have it depends on the child, depends on the age of the child, but at earlier ages, they do not yet have the impulse control and capacity to really self-regulate just yet. So I do think that especially for younger kids, it's very distracting to have devices when they're, need to be doing other things, and it's very difficult for them to learn that self-control. Yet I do agree that the ultimate goal is that they need to learn how to manage these things and also learn when they overuse, how does that impact them?
So this is the final question. I think, unfortunately, our time is running short, but this is an important question. And this is one that says, what are the proper steps for a school to take with a very young student who exhibits violent behaviors and constantly says they want to harm others, and there seems to be little help from their doctor? Dr. Foyer, we'll start with you.
Yeah, so I mean, I think again, difficult to answer very specifically, but I think, schools have different resources at their hand about having kids assessed for what are the issues that are going on with the child. And if their, own doctor has not, seemed to be helpful, working with the parent, working with the school resources to make an assessment of what might be going on and what kind of help they might need. I think those are some of the things that schools might be able to do. It's really if things are dangerous or anybody is in an unsafe situation, it often does escalate to an emergency or hospital visit sometimes. But really engaging the family and really working together as a team is, I guess, my suggestion for this, but it's very hard to be too specific about it.
No, it's just a heartbreaking situation. Dr. Reeves-Bright, what say you?
No, definitely, it's a difficult situation. And, we also want to make sure that we're working as a team. So the parents, the doctor, the counselor that's in school, hopefully that everyone is sharing information and sharing a treatment plan. And of course, as Dr. Ford mentioned, if there's any emergency or violent or aggressive behavior that needs to be addressed, it may be necessary to make a visit to what may be a emergency room, or sometimes there's the walk-in. I think that's also at Cohen's that may be available for an evaluation, but definitely not losing hope and keeping everyone in the lines of communications open.
And trust your gut as a parent too, whatever situation or side you fall on there. If you need to take other action, no doubt something you should do if that's what you feel. Dr. Foyer, Dr. Reeves-Bright, thank you so much for your perspective. It's been really an eye-opening experience. Thank you all for listening, and thank you for letting me be a part of this important conversation. It really is something that will continue. Fred, thank you so much for the opportunity to help facilitate the conversation tonight. We definitely, it's something that will continue, no doubt.
Absolutely, Mike. Very, very interesting. Very relevant, very much needed conversation. And I'm really thankful that we had the opportunity to have this dialogue. And hopefully this will not be the last. It should be the beginning of an ongoing dialogue. And I'd like to just take this moment to thank our trusted partners, the New York Edge and Northwell Health, for making tonight's webinar possible. Thank you also to our attendees. We appreciate you taking time from your busy schedules and recognizing the importance of supporting the mental health and wellness of our children. At Fidelis Care, we're dedicated to ensuring that all New Yorkers have quality and affordable health insurance benefits. And as a statewide health plan serving more than 2.3 million members across New York, we value these collaborative efforts with our partners such as the Edge and Northwell Health in the mission of delivering health equity outcomes to all. Our Fidelis Care team is easily accessible throughout the communities of New York via our local offices, our community office vehicles, and on-site presence at providers and partner locations. So we welcome you to give us a call at 1-888-343-3547 or visit us at www.fideliscare.org. Once again, thank you and have a wonderful evening, everyone.